Summer is over, and that means it's back to school time. We know you have a lot of questions. One of them may be if your child gets hurt or has an illness, do they need to go to the emergency room or wait and see the pediatrician? Let's take a walk over to East Tennessee Children's Hospital expert Dr. Ryan Redman for answers.
Urgent cares are designed for kind of minor illnesses, things that you would normally go to a doctor's office for. So including things like small cuts, bumps, bruises, things you're worried about, could have some minor breaks, that type of thing. Emergency departments are generally made for the sicker kids, for kids who are having trouble breathing, who are having trouble with hydration, need IV fluids, are having neurologic problems. Any of those bigger things really require an emergency department with all of the capabilities that we have.
The Children's Hospital Emergency Department is safe and ready to roll. Tell everyone you know it's one of the safest places you can be when it comes to avoiding COVID-19.
We have spent the last several months, of course, not only developing but also refining all of the things that we've done to try and make sure that we're safe. So we have come light years as far as protecting our staff, protecting the patients, making sure that everything is disinfected on a very regular basis, and this ends up being probably one of the safer places that you can be.
The ER is not just for COVID-19 patients. It's for whoever needs help. Redman says it's important not to wait if your child is sick. Bring them into the ER or take them to urgent care based on what you think is best. Kids' health can deteriorate faster than adults, and sometimes they can't always tell doctors how they feel in detail. That's why it's important to get the medical attention as fast as you can.
Of course, everyone's going to be wearing masks and other forms of personal protection. We revised our registration process, so you actually can do that all now on your device, so you don't have to touch anything that's been in anyone else's hands. We've developed a lot of our CarePoint testing can now be done virtually touchless, and we're trying to eliminate the amount of extra people that are kind of in rooms and that you're seeing.
And don't shy away from the construction. Our progress hasn't changed the time and patience we pledge to give you if you need us.
We are doing a lot of construction, which is going to end up benefiting the patients of this region, I think, immensely. It's going to be a really neat new department, a lot of which we've already moved into. But it does look a little bit funny from outside, but I assure you that we are open and ready to serve patients.